But even though the death toll is dropping worldwide, the number of cases is rising right here at home. Warwick, Posey, Gibson, and Vanderburgh counties have moved back into the yellow zone. Now, we had been in the blue zone, which meant the COVID-19 spread is low. This yellow designation now means the spread has increased and is now considered moderate. Joining us now is Dr. Brad Scheu, Vice President and Chief Medical Officer of Deaconess Clinic. Dr. Scheu, thank you so much for joining us today. Right off the bat, I got to ask you, is this the start of another surge?
Well, we're definitely concerned that that's a possibility here. As you said, we are seeing a rise, and we expect that the variants are playing a big part in that. But it remains to be seen exactly how high it will rise.
You're talking about the variant, the Delta variant. Have you seen that here in the tri-state?
So we feel very confident that the Delta variant is the most predominant variant here locally. It does require some specific genetic sequencing that the state supports us in doing, and that can take 2 to 3 weeks to get those results. So we don't have confirmed cases yet, but we feel very confident that's the most predominant variant.
Right,
here.
And I understand it's pretty much dominant all across the U.S. at this point. My question is, how do we get control of this situation if cases are starting to rise again?
Yeah, so I know people get tired of hearing the same message, but the answer actually is simple, and it's really just getting vaccinated. We are finding that it's the unvaccinated patients that are getting the Delta variant, that are continuing to get COVID, and it's those patients that are ending up in the hospital and in the ICUs. And although the deaths are lower, it is typically an unvaccinated patient. About 99% of cases of hospitalizations and deaths are now in the unvaccinated patients.
So repeat that one more time, because we really want to drive that home. You said 99%?
That's right. 99% of the cases of hospitalizations and deaths across the nation are now from unvaccinated patients.
Wow. Okay, so many in the tri-state have begun gathering again and returning to normal as if, the pandemic is over, it's past. Is this part of the problem? Are we becoming complacent?
Well, I think definitely the taking down the masking is playing a role in this, but we had a really good uptake initially of vaccines locally, and I think just that's the opportunity is continue to vaccinate those that have not yet, because the more more people that are vaccinated, the less places a virus can go and the less transmissible it can be. So even without the masking, if we just get vaccinated, we can really put a stop to the path of this virus.
Now, I'm going to ask you a personal question. As a healthcare provider here in the tri-state, you've just been still going through the pandemic, but you've been through the worst of the pandemic, and now seeing, after we've gone down to the blue zone, growing back up into the yellow zone now, does this concern you? How do you react to us being now in the yellow zone after so much effort to get it down?
Well, it is concerning. I mean, our entire team here has been in such a marathon trying to help take care of our patients, and definitely discouraging to see us take a slight step back. But I'm very optimistic that we can still get ahead of this, that people can hear this message, that the opportunity hasn't passed. It's still very easy to go get vaccinated and do the right thing. And we're still here to take care of patients as needed and have plenty of capacity to do so. But if you haven't become vaccinated yet, we still have time to get ahead of this.
And real quickly, with the time we have left here, what about masks? There's no mandate at all now, and you don't see them out nearly as much. Hopefully it's because everyone is getting vaccinated, but should we be wearing masks if these numbers keep rising?
Well, I think that's something we'll have to be monitoring closely with the health department's help and CDC's help, nationally. Certainly if you're unvaccinated in a social setting where you're going to be in a close proximity, wearing a mask is the right thing to be doing. Now, if you have been vaccinated, you can enjoy some different freedoms. So I think if unvaccinated, masking is the right thing to do to protect you and protect others around you.
Okay, Dr. Brad Scheu, VP and Chief Medical Officer of Deaconess Clinic, thank you so much for taking the time to talk with us today about our area moving into the yellow zone. We appreciate it.
Thank you.